Hi, I'm Elaine. This is Scott and Lars. We are the supervisors on the PhD2, which is looking at optimal resistance training for people moderately affected by MS.
Yeah, and of course, among several exercise modalities, we have strength training, and that is, in our opinion, particularly important. Not only can it help improve muscle strength and power, but it can also help improve physical function, especially walking capacity. And it's been shown to be quite effective in reducing this MS-related fatigue that's very prevalent in persons with MS. In addition, it may even elicit neuroprotective effects, so it may have some preservatory or restorating effects on the nervous system in MS patients. But we still lack information for those who are more disabled, so those that are categorized as moderate to severe persons with MS. We still lack a lot of information about how strength training is actually benefiting these persons. And that information is quite crucial in terms of providing proper guidelines and advice about how to deal with strength training in this population of MS patients.
And how we're going to do that within this PhD project is split the project into three main phases. The first one is going to look at developing a resistance training program for people with moderate levels of disability through a process of co-production. So working directly with people that have MS to identify the most appropriate, most feasible modes of resistance training, as well as intensities, and also the most appropriate outcomes that we can use to quantify the effects of that intervention. The next phase of the PhD will be then looking at dose response of various different intensities of resistance training to make sure that we can identify the most optimal intensity of resistance training. And then the final phase will be informed by phase 1 and 2. And that will be a larger randomized controlled trial to actually then look at the effectiveness of the intervention developed in collaboration with people with MS.
Yeah, so this work is going to be really impactful for people with MS and for healthcare professionals in helping them determine how much they should be doing in terms of resistance training. And also it'll have an impact on updating the new guidelines for physical activity for people with MS. So we hope that by giving you this little short overview about the project that you might be interested, and we hope to see your applications.